family history of stroke? Is your risk genetic or lifestyle? Imagine discovering that a close family member had a stroke. You might wonder if your own risk is written in your genes or if your choices matter more. The truth is, both play important roles in stroke risk. Your inherited genes can influence how likely you are to develop certain health conditions that lead to stroke, like high blood pressure or high cholesterol. Having a parent, sibling, or child who has had a stroke can increase your risk by about 30 to 44% compared to someone without that family history. This increased risk can come from inherited conditions or gene mutations that directly raise your chances, or do so indirectly, by causing other issues like diabetes or heart disease. Some rare genetic disorders are known to cause strokes, but most genetic influence comes from common gene variations that affect your health. Also, people with a family history tend to experience strokes earlier in life and may face higher chances of having recurrent strokes. But genetics are just part of the story. Lifestyle and environment are just as crucial. Families often share habits like what they eat, how active they are, whether they smoke, and how they handle stress. These shared habits can significantly influence stroke risk. For example, high blood pressure, smoking, obesity, lack of exercise, and unhealthy diets are major modifiable risk factors. Even if your genes put you at higher risk, you can lower your chances by making healthier choices. Maintaining a healthy weight, quitting smoking, exercising regularly, and eating a balanced diet can all help reduce your risk. Interestingly, lifestyle choices can even influence how your genes behave through epigenetic mechanisms, which means your environment can turn certain genetic risks on or off. The interaction between genetics and lifestyle is complex but important. Research shows that living healthily can reduce stroke risk at any genetic level. In fact, a good lifestyle can sometimes lower the risk in someone with high genetic susceptibility to below that of someone with low genetic risk but poor habits. Because many genetic risks are affected or amplified by environmental factors, prevention strategies focus heavily on lifestyle changes and managing medical conditions like high blood pressure and diabetes. If you have a family history of stroke, it's helpful to keep detailed records of which relatives had strokes, their ages at the time, the type of stroke, and any related health issues. Sharing this information with your healthcare provider can help assess your personal risk and decide if genetic counseling or testing might be useful. Regular checkups to monitor blood pressure, cholesterol, and other risk factors are especially important. Taking control of modifiable risk factors through lifestyle adjustments and medications, if needed, can make a big difference in reducing your risk. In summary, while your family history and genetics do influence your stroke risk, your lifestyle choices are powerful and often modifiable. Focusing on healthy habits and managing medical conditions aligns with current medical guidelines and can significantly lower your chances of having a stroke, no matter your genetic background. Remember, everyone is unique, so personalized medical advice from your healthcare provider is always the best way to understand and manage your individual risk.